Jiankui, you are a Chinese scientist. You use CRISPR on human embryos. You want them resistant to HIV. Twin girls are born. You announce it. The world is horrified. You are arrested. The court rules you forged ethics papers. You are sentenced to 3 years in prison. Baby doe, your newborn has Down syndrome and a blocked esophagus. You refuse surgery and feeding. The baby dies in 6 days. Public outrage leads the Reagan administration to issue baby doe rules. Disabled newborns must be treated regardless of parental wishes. Unit 731. You are a Japanese army doctor in occupied China. You run a biological warfare unit. You infect prisoners with plague and anthrax. You perform vivisection without anesthesia. You freeze limbs to study frostbite. Hundreds of thousands die. After the war, the US grants you immunity for your research. You are never tried. Tuskegee. You are a poor black man in Alabama. The government offers you free health care. They never tell you you have syphilis. Penicillin becomes the cure. You are still not treated. The study runs for 40 years. Over 100 men die. A journalist exposes it. Dax Cowart. You are 25. You are severely burned in a propane explosion. You ask the doctors to let you die. They refuse. They strap you down and treat you for 14 months. You survive. You become a lawyer. You spend your life arguing they should have let you go. Pfizer Trovan. You are a Pfizer researcher. A meningitis epidemic breaks out in Nigeria. You arrive with an experimental antibiotic. Parents are not properly informed. 11 children die in the trial. Others are left deaf or brain damaged. Nigerian families sue. Pfizer settles for $75 million. Willowbrook. You run a hepatitis study at a school for disabled children. You deliberately infect new arrivals. Parents are told enrollment depends on it. The study runs for 15 years. You defend it because hepatitis was already in the school. It becomes a global symbol of research abuse. Hwang Woo-suk. You are a Korean scientist. You announce you have cloned human embryonic stem cells. You are a national hero. A whistleblower leaks the truth. You faked the data. Female colleagues were pressured to donate eggs. You are fired and convicted of fraud. Guatemala syphilis study. You are a US researcher in Guatemala in 1946. You deliberately infect prisoners and mental patients with syphilis. 1,300 people are exposed without consent. You are testing penicillin. The study is buried for 60 years. President Obama apologizes in 2010. MK Ultra. You are a CIA officer in the 1950s. You run a covert mind control program. You dose American and Canadian citizens with LSD without consent. You experiment on prisoners and psychiatric patients. One subject jumps from a hotel window and dies. The program is exposed in 1975. Most of your files are already destroyed. Thalidomide. You are pregnant in the 1950s. Your doctor prescribes a new drug for morning sickness. It is marketed as safe. It has never been tested on pregnant women. 10,000 babies are born with severe limb deformities, half die. The drug is withdrawn in 1961. The case creates modern drug regulation. Conjoined twins. Your twin daughters are born joined at the abdomen. One twin's heart keeps both alive. Doctors say both will die unless they separate. Separation will kill the weaker twin. You are devout Catholics. You refuse. The hospital takes you to court. The court rules separation is lawful. One twin lives. The other dies on the table. Cincinnati Radiation. You are a doctor at the University of Cincinnati. From 1960 to 1971, you irradiate cancer patients. Most are poor and black. The research is funded by the US military. Your patients are not told the real purpose. Many die. A Senate report exposes you in the 1990s. Henrietta Lacks. You have cervical cancer. You go to Johns Hopkins. Doctors take your cells without telling you. You die. Your cells don't. They are used to make the polio vaccine, IVF, and cancer drugs. Companies make billions. Your family is told 20 years later. Charlie Gard. Your baby has a rare disease. The hospital says treatment will not help. You raise £1.3 million for experimental care in America. The hospital refuses to let him go. You go to court. Every court rules against you. The judge says he should die with dignity. Andrew Wakefield. You are a British doctor. You publish a study in The Lancet. You claim the MMR vaccine causes autism. The study uses 12 children. Vaccination rates collapse. Measles returns. A journalist proves you faked the data. The paper is retracted. You are struck off the medical register. Jesse Gelsinger. You are 18. You have a liver disorder. You volunteer for a gene therapy trial. You are not told earlier patients had bad reactions. You are injected with the virus. You die 4 days later. The trial is shut down. The university settles with your family. Alfie Evans. Your son has a brain disease. The hospital wants to switch off the ventilator. You want to fly him to Rome. Italy grants him citizenship. The Pope intervenes. Every UK court rules against you. The ventilator is removed. He breathes on his own for 5 days. Then he dies. Tony Bland. You are 17. You are crushed at Hillsborough. Your brain is destroyed. Your brain stem still works. You breathe on your own. A feeding tube keeps you alive. 3 years pass. Your family asks for the tube to be removed. The House of Lords agrees. It is the first UK case to let doctors end life support. The Monster Study. You are a speech researcher in Iowa. You place orphans in your study in 1939. You tell normal-speaking children that they stutter. You berate them for every mistake. Several develop lifelong speech problems. The study is buried for decades. The University of Iowa apologizes in 2001. Tony Nicklinson. You have locked-in syndrome. You can only blink. You describe your life as intolerable. You ask the High Court to let a doctor end your life. The court refuses. You refuse food. You die 6 days later. Terri Schiavo. You are 26. You collapse at home. Your brain is starved of oxygen. You enter a persistent vegetative state. Your husband wants the feeding tube removed. Your parents do not. The case runs for 15 years. Congress and the president intervene. The courts side with your husband. The tube is removed. You die 13 days later. Ann Quinlan. You are 21. You collapse at a party. You enter a persistent vegetative state. Your parents ask the hospital to remove the ventilator. The hospital refuses. The court rules in their favor. The ventilator comes off. You breathe on your own for 9 more years. The case becomes the foundation of right-to-die law. Bouvia. You are 28. You have severe cerebral palsy. You ask a California hospital to let you starve to death. The hospital force-feeds you. You go to court. The court rules competent adults can refuse treatment even if it leads to death. You change your mind. You live for decades more. Tarasov. You are a psychologist in California. Your patient tells you he plans to kill a young woman. You alert campus police. You do not warn her. He kills her. Her family sues. The court rules therapists have a duty to warn identifiable victims. Vipholm. You are a Swedish researcher in the 1940s. You run a dental study at a home for the mentally disabled. You feed patients sugary toffee to study tooth decay. Many lose their teeth. The study runs for 10 years. It creates modern dental advice on sugar. Consent is never obtained. Nuremberg doctor's trial. You are a Nazi doctor. You run experiments in concentration camps. You freeze prisoners. You expose them to mustard gas. You infect them with disease. The Allies put you on trial in 1946. 16 of you are convicted. 7 of you are hanged. The trial creates the Nuremberg Code. Christian Barnard. You are a South African surgeon. In 1967, you perform the world's first human heart transplant. The donor's heart is taken before cardiac arrest. Critics say you have redefined the moment of death. Your patient lives 18 days. The case forces medicine to formally define brain death.